Hey, this is Brian again, and I'd like to ask you to do a favor. We can't do this work without people like you, so if you can, please like, share, subscribe, tell your friends about Bring Back the Porch.
And I just remember there was a surgeon in Saskatoon. His name was Dr. King. He did a lot of arthroplasty, so joint replacements, and he just always seemed to be having fun in the operating room. I could see in his clinics that his patients really loved him and what difference he made in their lives. And, I think I really like that immediacy of being able to do something and see the result almost immediately.
This episode of Bring Back the Porch brought to you by Bernie Leahy, River Street Realty. Let's get you home. And joining me on the porch this time, very special couple who we'd like to welcome to the porch, Tia and Dr. Luke Heinrichs. Welcome.
Thank you so much for having us. We're so excited to be here.
Yeah, we really appreciate the time to have a chat this morning.
Now, let's talk about your journey here. How did you arrive in Medicine Hat? Because you have been a student for a long time. I was looking on your website. You've 3 different universities, I think?
Yeah, so, I grew up in Saskatoon, so I did my education there along with medical school in Saskatoon at the University of Saskatchewan. And then after my medical school, I applied to a orthopedic surgery residency program in Edmonton. We go through a matching process. So I matched to University of Alberta in Edmonton. So I spent a number of years there doing my residency program, followed by a arthroplasty, so like a joint replacement fellowship. So it's an extra year of training there. And then after that, I was still very interested in sports injuries and arthroscopic or minimally invasive surgery. So I did spend a year out in Halifax at Dalhousie, working with a group of surgeons out there, kind of more specifically training on sports and arthroscopic and joint preserving surgeries. So, yeah, it's been a bit of a long journey. At the end of my second fellowship, I was kind of in a lucky year because, every year is a little bit different for orthopedic surgery in terms of how many jobs are available and where they are and, what they might involve, what the group might be looking for. And during that year, though, I had a few friends reach out to me about a job opportunity in Medicine Hat. One of the surgeons who had worked here for quite some time, a previous University of Alberta alumni, similar, Dr. Bering, had retired, so they were looking for a replacement, and his practice was a mixture of joint replacements and sports surgery. So it was just a very kind of good timing, it was a good fit from what skills I had trained for. And we also liked that we were kind of still in Alberta, but close to home in Saskatoon, but close to the mountains and things we like to do out there. And, so it's just been an excellent fit. And, it's just been a constant positive surprise to me. I'm just constantly positively surprised by, the job here. I'm fortunate to kind of showed up not knowing much about the place, but you come here and you walk into the hospital and it's like this beautiful surgical facility. Like, honestly, you would not find such a nice looking OR suite really in any of the bigger centers I've worked in. In Halifax, there was surgical sites where you'd feel like you're working in a broom closet. And it's just been very nice. I mean, honestly, there's been so many things to learn into my junior practice, my early years of practice, like learning how to run a practice, all the moving parts to it. But, there's been some great supports along the way. The hospital's been very supportive of me bringing in new surgeries and new procedures that we can do for patients. And, it's been an excellent group of colleagues that I've had the opportunity to work with as well.
How's life been for you, Tia?
Yeah, I feel like when me and Luke were going through the journey of looking at different job opportunities across Canada, and there were opportunities in BC, Manitoba, Ontario, even still in Nova Scotia. And I think when we were evaluating where we wanted to put our energy, a big part of it was work-life balance with our family. We have 2 young kids that are 5 and 7, and I think us living in Halifax for that year was an amazing experience, but also kind of isolating and a little bit of away from our family, and it was just a little difficult to travel. So when Medicine Hat popped up as an opportunity, I was super excited. I'd heard great things about the city. We have a few friends that are originally from here, and so me and Luke talked about it seriously, and I said to him, this might provide us that work-life balance that we're looking for, because watching Luke go through his medical training journey, he has sacrificed so much to be where he is today, and I feel like we work so well as a team, and I really just wanted to make sure that we could find that balance. And it's been an amazing city to raise our kids. We're able to drive home, grandparents are able to visit us. I feel like it's been such a great fit and a way for us to kind of finally take that deep breath after so many years of Luke's really, I guess, like, his training has just been something that I always feel like I'm in awe of him. He's just handled it with so much grace, and I'm just so proud of him.
Just one day at a time, Tia.
There's always a good woman behind a good man, they say. So you fit the bill nicely. Thing about Medicine Hat is it's very similar to Saskatoon in that the river, South Saskatchewan River, the way the cities are oriented. So it's similar yet different.
A little milder in weather.
Yeah. Saskatoon in the wintertime, you can get on the golf course here a whole lot earlier than you do in Saskatoon.
Yeah, it's a beautiful city, like truly a whole different landscape than anything else we've experienced in Saskatoon, Edmonton, and Halifax. It definitely is a really special place.
I would imagine that with your credentials and your skill, you were heavily recruited, so you had to make a difficult decision when you decided to come to Medicine Hat, because I can go to Broadway. I can be a star.
Well, yeah, it's different for everyone. I mean, certainly I had a few other opportunities, but, I think me and Tia had to make this decision together, and we've really, I think it's turned out very well for us. So,
how did you decide to be a surgeon?
That's a good question. Probably on a whim.
Oh, really?
Fortunately or unfortunately, sometimes you end up working with certain doctors just along your medical school journey who just have, undue influence for whatever reason. And I just remember there was a surgeon in Saskatoon. His name was Dr. King. He did a lot of arthroplasty, so joint replacements. And, he just always seemed to be having fun in the operating room. I could see in his clinics that his patients really loved him and what difference he made in their lives. And, I think I really like that immediacy of being able to do something and see the result almost immediately. And, I grew up working on cars and mechanics and tons of side projects always. So I think it's just, it's perfect that I fell into a job where I get to use, hammer, mallets and screwdrivers and drills and power tools.
You make it sound so simple.
Yeah, well, it often is. I mean, I think we sometimes tend to overcomplicate the things we do, but if you can really, abstract it down to its basics, it's, just another technical skill set that, again, I feel very fortunate to have a community that supports me doing this type of work.
You mentioned some of the new advances that are out there right now in surgery, and you were drawn, I think, to sports injuries in particular.
Yeah, so part of, I operate here with 4 other colleagues, so it's a group of 5 surgeons in town here. We all kind of have our own special interests and special skill sets. One thing that I was kind of fairly adamant and actually played into me taking this job was bringing a new surgery that's, new to, I guess, southern Alberta. There's a couple surgeons in Calgary doing it, but it's called hip arthroscopy, where, basically it's camera surgery around the hip. It does take some special equipment and, certainly is a bit of a more challenging subset of surgery to deal with. But, so that's been one thing that we are slowly building up in southern Alberta is being able to manage, active young athletes with tears of the labrum in the hip and addressing that in a minimally invasive way. The other project I've been working on for the last year is I'm a very big advocate when I was of robotic surgery for knee replacements. When I was in Halifax, I was lucky enough to spend some extra days working with one of the surgeons out there, whose name was Dr. Dunbar, who was a surgeon who was involved in the design team for one of the companies and their robot. So I got to spend some time and see what he does with his robotic system for knee replacements and how it really fundamentally changes how we do that surgery and how we, potentially what results we get from that surgery. So, I think the general trend in the knee replacement world has been to involve these robotic technologies. And I think robot's a strong word. I mean, in the simple form, it's basically a camera system and a cutting device, so such as a saw or a burr that lets you basically plan out a surgery and then execute it with a little bit extra precision, which allows you to do some very interesting things with knee replacements. The latest stats I've heard in the United States is that about 2/3 of a certain company's knee replacement are being done robotically. So, in Alberta, I think there's a huge amount of interest around it. I think the government has been very appropriate in approaching it and making sure that the costs associated with us bringing in these new technologies doesn't become too burdensome. But, I would like to this year have a robot here in Medicine Hat and really see what difference we can make to the functional results we get from a knee replacement surgery for patients.
I was reading this morning, too, I think it's in Sault Ste. Marie, Ontario, where they're taking it another step further where the surgeon through the internet is somewhere other than where the patient is. They're stepping out a little further along the line. I don't know if we're ready for that in Medicine Hat yet. Yeah,
I think that's, I've seen that for some types of surgery. I think for orthopedics, it's still I, for the foreseeable future, will still be having to stand in the room and using the knife. But, it's just, again, robotic technology for us in orthopedics is just essentially a navigation system that lets you execute a surgical plan with a little bit more precision. But, it's hard to really ever have an idea of what your future might look like in practice because, that was a recurring theme I would hear from some of my older surgeons that I worked with in Edmonton is that, at the start of their practice, they, 10 years into practice, their practice fundamentally changed. So, for all of us, it's really this constant learning, evolving, changing. I'm always curious about what things I'm doing today that in 10 years might seem out of date, or I'll look back and say, why was I doing it this way? Constant changes anyway, but it kind of, that's the fun part about it.
That's the question I was wondering, though, is that because you're so busy day to day, how do you keep up on the new trends and how do you, keep yourself well-versed in what's happening out there?
So that's a great question. I mean, it's a complicated thing for physicians and surgeons. I think we're often supported in terms of, and we actually have mandated continuous medical education that we have to do to maintain our licensure. But for a lot of us, it's, involves taking extra time out of, away from family and away from practice to go attend a course in another city or various things, attending conferences. It's important to kind of keep up with those things. And, I try to, every few months, get out of town for some kind of conference or meeting or, but fortunately we're pretty well set up in our field for everyone's always willing to show you a new device or teach you a new way of doing things.
They don't keep it a secret.
No, no. So, it's fairly easy, but it is time that you have to take out of your day to read a paper or, travel somewhere to a conference. And, it's gets busy very quickly, I'm finding.
Yeah. And Tia, you're busy too. You're not just sitting at home looking after the kids. You have something on the go too.
Yes, I'm a registered nurse. I work in the NICU, and then I have a private nursing practice in the community. And, I think the question asking about like continuing education, it really does kind of highlight just how all-consuming I think a surgical practice can be. When Luke comes home from either a clinic day or the OR, like he doesn't just get to necessarily kick his feet up and call it a day. He is looking at research papers, arranging education conferences, messaging colleagues about cases, getting opinions on cases. I feel like it's just a bit of a lifestyle, and for us to be able to support each other and raise our kids, I do feel like the balance we have in Medicine Hat and the flexibility I have with my nursing career does allow Luke to do whatever he needs to do during his workday, which can be very, very unpredictable.
It's a team.
It is a team.
Oh, for sure, and we're certainly still figuring it out.
Wait times, that's one of the things that's in the news a lot. Do you get frustrated sometimes because you have people need to see a surgeon right away and they need to get their work done, but
certainly
there are others ahead of them?
Yeah, every day, it's a big challenge, I think, 2 years into practice, managing how long people are waiting to see me from a referral from another doctor, and how long from seeing me they have to wait, or how long they have to wait after seeing me for a surgical date. It seems like there's, some challenges right now in southern Alberta at getting to things in a timely fashion, because, in general, if I had it my way, I think I would like my patients to wait no more than 3 months to see me and 3 months for surgery. And, in that kind of time frame, I think for a lot of people, they still, seeing me, deciding to do something, still feel like they get to make their own decisions about their health and what they have. But, when they see me, and I might tell them for some things it's, a year or maybe even more than a year to wait for surgery with a bad hip or a bad knee, it's a really frustrating thing for people these days. And I honestly feel like, it probably doesn't feel a lot like they're getting to make their own decisions for their health at that point.
I'm wondering if people ever come up to you and say, "Hey, doc, my shoulder's a little stiff. Can you, what do you think?"
Medicine Hat's definitely the city of drive-by consults, for sure. Even a few months into practice, I noticed my trips to Costco were like,
oh boy,
I'd usually run into a few patients, which is awesome. It's definitely a small world in that regard, which is, I'm learning to just love that too.
Because hometown.
I appreciate my anonymity some days, but, I also love seeing my patients and how they're doing. So
the other side of this that we haven't touched on is prevention. Do you have any recommendations for people that maybe if they've got a condition or maybe they can take steps to prevent having to come and see you?
It's so hard to, people see me for, say arthritis or rotator cuff issues or broken bones. There certainly is a whole lot of things that people could be doing. And I think, my practice is best understood in terms of that we should be maximizing everything except surgery before coming to surgery, because surgery has its risks. Even when everything goes right, there is risks of something horrible happening. So it's a good question. There's no simple answer to it, but I always am a huge proponent for all of my patients to really maintain strength and activity and whatever they can do. Even for some people it becomes very difficult due to pain, but whatever they can be doing in that regard. Prevention gets to be very complicated, because when you talk about even like a problem like arthritis, it's multifactorial. So people have, history of previous injuries that might be contributory. They might have genetic factors that predispose them to arthritis. There's so many different factors behind it that I don't want my patients to come to me and feel like they did something wrong or that they should have done something different so that they wouldn't end up where they were sitting. But, certainly I am a huge proponent of people maintaining their strength and activity and general health. And, managing things like diabetes and blood pressure and all these type of things. But, unfortunately, we don't have a great cure for arthritis these days, except
I wish you did.
metal and plastic. So it's a challenging problem because, as we see people living longer and being more active, we definitely see increasing demand for these types of surgeries.
When is the best time for someone to seek help?
I think really at any point when they're just feeling overwhelmed with their situation that they're dealing with. So, there's a lot of things that a family doctor can help people with, whether it's, just getting basic investigations like an x-ray, trying things like injections, trying things like physiotherapy, optimizing other health issues. Certainly, I see referrals at all ends of the arthritic process. So anywhere from people just experiencing lots of pain with relatively mild disease based on x-ray to more severe. In general, in Canada, we kind of typically, for a knee replacement at least, like to wait till someone's arthritis is quite advanced on an x-ray before intervening. And, that in itself is a bit of a complicated question, but, I don't have an absolute answer, I guess, to that question, but, basically at any time, I would say if someone's just feeling like they're not managing well.
Yeah. We do tend to just, suck it up, put up with it, I'm not that bad. And they delay, and people convince themselves that they don't need to see a surgeon or a doctor. So we just continue on, I guess.
Southern Alberta has some hardy folk down here, that's for sure.
Yeah.
I, just having Christmas with my family, I can see my dad slowly getting, worse and worse with his mobility, and but I think he just wants to keep toughing it out for now, and that's totally fine for anyone.
I sympathize with your father because, I find now when I get out of a chair, I make the same noises my dad made when he was my age. So it's, it's just how life goes. So the future for both of you, long-term in Medicine Hat?
I'm going to let Luke answer that question.
I think so. I mean, it's interesting getting a couple of years into practice and you start to realize, things that you would like to have and things that are going very well and, things you'd like to improve on. And, it's just been, like I said, I don't see any end in sight here. It's been great for my family and, great for myself and, very supportive. So, I've been super happy. The one piece I would like to kind of involve more is seeing more kind of medical students and learners in the operating room. I've been lucky enough to have some old residents and resident surgeons and medical students actually come down from Edmonton to work with me for a while, and it's like that's something I would like to continue to involve in my practice. We're fortunate enough in Lethbridge, they are opening another medical school, so I'm going to be involved in taking on and teaching medical students. I do have family doctor residents who rotate with me routinely, and I'd also like to kind of involve some of the residency programs, say in Calgary, of having resident surgeons come join me, because I think that's a really great way to evaluate your practice and also be exposed to new ideas and ways of doing things, and it's just a lot of fun. I just spent 2 weeks on a medical mission in Ecuador 2 months ago. So we went down there with a group of nurses, physicians, mostly from Calgary, and did about 50 surgeries on the needy people and terrible hip arthritis. So that was a lot of fun, and it just was a reinforcement that that's the educational piece, and working with people at various stages in training is like super important to me. So,
so being a mentor,
continue to work with that.
Being a mentor.
Yeah, no, exactly, and I think that's how we all learn, and I think now at this point, I think like I said, I think there's a lot to teach myself through that process. So something I just kind of want to keep building here in Medicine Hat.
Yeah.
It sounds. Oh, go ahead, Tia.
I love hearing how Luke wants to evolve his practice, and he knows that I love it here, especially as the parent that does all the pickups, the drop-offs, carting the kids, the activities. That is definitely mostly my role, and I find it so simple here and so easy, and we have so much extra time at home because we don't have these long commutes, and I just really want to be supportive of Luke building and growing his practice here in Medicine Hat in whatever way is going to give him that satisfaction. And I'm so excited for him to have the opportunity to be able to mentor and train upcoming medical students and residents. I think you're going to do a great job of that.
Well, as you say, we have one of the best surgical suites anywhere. We have style of life that people like, and I think the future looks good for the both of you and for Medicine Hat.
Thank you so much.
Very thankful for your time here on the porch.
Oh, thank you so much. I really appreciate these opportunities, and it was great to meet you and have a discussion this morning, but I really appreciate the time.
Thank you.
Thank you.
Hey, this is Brian again, and I'd like to ask you to do a favor. We can't do this work without people like you, so if you can, please like, share, subscribe, tell your friends about Bring Back the Porch.